Welcome everybody, thanks for joining in today. My name is Dr. Bonola Mashishi and this is Ask Your Doctors. A special warm welcome to all the phenomenal women out there. Happy Women's Month. Joining me today is our host, Dr. K, and of course our phenomenal guest, phenomenal woman, Dr. Nokubonga Khoza. She's our expert dermatologist today in our new home. Welcome. Hi, Doc.
Hi, Doc. How are you?
Good. How are you?
Thank you.
So today we are going to just be talking about eczema and dry skin. So we'll just jump right into it, and maybe Doc, you could just explain to us what is eczema.
So, eczema is another chronic inflammatory condition of the skin. So commonly what you will see in people suffering from eczema, they'll have dry skin, they'll have itching, and then they get the rash. So the rash is usually red or dusky pink. It usually is oozy or weepy, maybe painful, and sometimes, very rarely though, it may be infected. So eczema in its true self is actually a genetic condition that has a problem with your skin barrier. So true eczema is a result of a defective skin barrier of the skin.
Okay. And what would cause this defect in the barrier?
So the causes, mainly it will be a genetic influence. So what the genes or what the genetic influence does is that when the skin is the skin is made up of skin cells, and then it's made up of oils or proteins that glue the skin cells together.
Okay.
So people with eczema will have maybe malformation or abnormal levels or abnormal types of the oils that are meant to glue the skin cells together. So I always equate it to tiling the floor. So you've got the tiles, which are the actual skin cells, and then you've got the grout that glues the tiles together. Now in eczema, the problem is with the grout.
Okay.
So that grout is your cellular lipids that are meant to glue the skin cells together.
Okay.
And the genetic influence is on that specifically.
Oh, I love that analogy. It's so beautiful to understand. Yeah.
How much of it is immune reaction?
So what happens is, so you get the defect in the skin barrier. So it's almost like your skin has potholes. So because of that, you are then exposed to the environment. And that means like irritants can enter, allergens can enter, infections can enter. And then when they enter the skin, they trigger the immune system. So you then have activity of the immune system, and then you get inflammation, which is when the rash will come. So there is a role of the immune system in eczema, in that there is a shift into an abnormal functioning of some of your immune cells.
So maybe can you please just, for those people who, not really sure, what is the difference between eczema and dry skin? And how do we tell the difference between the two?
So it can happen. Remember, people with eczema have dry skin, but not all people with dry skin have eczema.
Okay.
So the difference between dry skin and eczema is the presence of inflammation.
Okay.
So it's the inflammation that leads to the rash, to the redness, the oozing, the crust, whereas dry skin is low levels of oils. So dryness is related to sebum production and sebum or oil distribution in the skin. It's not related to water or anything. It's related to reduced levels of the oil. And then obviously in patients with eczema, we know that they may have dry skin, and then they get the inflammation which characterizes the actual condition.
Okay.
Does this mean now if you oil the skin enough, you're fending off some of the problems, not all of them?
So the main way that we actually address eczema is, so I don't want to say oil the skin, because then people are going to go and throw oils in their skin. So we want to, so we want to moisturize the skin, and with active, proactive, frequent, liberal, as well as thick layers of moisturizer, you can actually minimize eczema. It's actually one of the most important steps in treating eczema because you're addressing the main problem, which is the barrier defect.
So if we now we understand eczema and how the tiling system actually works. So maybe can we differentiate or maybe explain to us the different skin types? So we've got dry skin and there's oily skin. So what else is out there?
So there's 5 skin types.
Okay.
There's normal skin. There are people with normal skin.
Okay.
And then there are people with oily skin. So oily skin is excess production of sebum. So the whole thing about skin types is the presence, how much sebum is in the skin. So people with oily skin have excess larger glands, sebaceous glands or oil glands, so they produce more oil. Then you can have a combination skin. So these individuals have normal skin on the cheeks, and then they have concentrated or larger glands in the T-zone. So they tend to be oily on the forehead, nose, chin, and they may be normal or dry on the flanks or the side of the face. Then you have dry skin. So these are people who produce less oil or less sebum. And then you have sensitive skin. So true sensitive skin is seen in conditions like eczema because there's a barrier defect, and also seen in conditions like rosacea, which we spoke about previously, because there's a barrier defect. So there's 5.
Okay. And is it possible for someone to sort of fluctuate between the different types as they age, maybe hormonal, whatever?
So definitely, and sometimes that's what throws people off. They don't tend to understand. So you can have oily skin, and then you may have dry skin. But also as you age, because remember we said the influences on your sebaceous glands is usually hormonal. So you find that as you age, especially in women like myself, I may have had combination or oily skin when I was younger, but as I age, my skin is becoming more and more drier. So you can fluctuate. Sometimes you can use products that will disrupt your barrier so much that you start having sensitive skin.
Okay.
And that also happens. And you can get skin sensitivity across all skin types.
Okay. So are there maybe different types of eczema that one needs to be aware of?
So there is. Most of the time we say eczema, but we are actually talking about atopic eczema or atopic dermatitis. But if you're looking at eczema as being a rash, then there's different types. You can have what we call hand eczema, it can just affect the hands. You can have what we call dyshydrotic eczema, something called pemphigus. So these are those individuals who have these small water-filled blisters along the fingers or along their feet. And then eczema can take different forms. So you can have round areas or round lesions. We call that nummular eczema or discoid eczema. Then you can have what we call contact dermatitis, and almost everybody will experience some form of contact dermatitis in their lifetime, and that is when you are reacting to irritants or allergens. And then you may have what we call stasis, which affects the legs. So it really depends on the cause and sometimes where in the body. So there's various types of eczemas, but those are the main ones.
Just if I can come in there, Doc, I sometimes have a personal experience of itch when I get exposed to juices that have preservatives in them. I can tell that's a thing.
So that comes in terms of other foods that we can eat that can trigger eczematous reactions, and yes, there are, especially in the childhood population. So I always say to people, you must eat food in its natural state, which is not nice. So you want your veggies from the ground to your mouth. You want your meat from the cow or whatever
to your mouth.
To your mouth. It's the processing, the adding of food colorings, the adding of preservatives that sometimes trigger these allergic reactions that we have to food. Although you can get true food allergies from peanuts, from shellfish, and in some individuals from eggs, and in some individuals from dairy. But sometimes we can, you can desensitize individuals from dairy reactions.
I mean, eczema seems to be maybe age-related, or it starts off at a certain age group. So Is it more common in children? Does it progress? How does it,
So it is
about?
more common in children, and I think that has a lot to do with immaturity of the skin, immaturity of the skin barrier, and immature immune system, but very strongly linked to genetic influences, whether it's from the mother or the father. You can inherit it from both parents, and you'll see that individuals with asthma, allergic rhinitis, conjunctivitis tend to have eczema, especially they may experience it in the earlier years. So we do see it a lot in children. And maybe the reason we don't see it a lot in adults is because most children would outgrow their eczema. 50% of kids with eczema by the age of 5 may not experience it and may not have the eczema anymore. And by 80% by the age of 8 may not have the eczema anymore. So we tend to see it mainly in that group because we know they outgrow it. And so when we see adult onset eczema, it may be related to immune related conditions or environmental factors that are affecting the skin.
Yeah, so it's quite very interesting, really, and I'm quite curious to know and to learn more. And you mentioned the skin types. How does that factor into being more prone to developing eczema, or is it not a factor at all?
So out of the 5, individuals with dry skin obviously are more prone to getting eczema. Individuals with sensitive skin are more prone to eczema. But remember, I said there's a category called contact dermatitis, of which all skin types can experience eczema at some point. So, it's very, very uncommon for oily skin types to have robust atopic eczema, but we do know that dry and sensitive are most likely. But you can have patients who have eczema and acne all together.
Yeah.
I've been curious myself. Does sugar make us more prone to eczema? Does it exacerbate it? Is that a thing with children as well?
No, I think people can have their sugar. I haven't actually come across that direct relationship. But what we know about sugary foods is that some of them can cause inflammation
That's what
inside the body, and sometimes inflammation may translate to inflammatory conditions in the skin. So, and obviously eczema is a big condition, and it's really linked to sometimes what is happening in your body.
I think everyone that watches our show is aware that some of it was inspired by my own ailments. And one of the things that I had to cut down on for my general proneness to inflammatory problems, especially respiratory, it was sugar.
Okay.
And it turns out that my eczema became a little bit better after I dropped sugar, but that's a story for another day.
Great.
Now let's talk treatment, Doc. How do we treat eczema?
So simple ways. So once you understand that eczema, the main problem is the barrier of the skin. So you start off with the defective barrier, then you get the triggering in your immune system, then you get the inflammation. So when we speak about treatment of eczema, we actually put it in those categories. So you want to address the barrier problem. People don't moisturize their skin. I ask all my patients, okay, so what did you, I've been trying everything. They'll be like, oh no, I applied. So how often did you moisturize your skin? I optimized once. So we don't moisturize the skin. So if we know that the issue is the barrier, so you need to actually moisturize at least twice. And I know black people don't apply moisturizer. I don't know why. Moisturize twice. Sometimes you may need to moisturize 3 or 4 times because the defect is too great. So you moisturize now, 2 hours later, you may be dry. So do it frequently and apply a lot. And then, so once you then trigger the immune system, you're going to get a lot of itching. So we can use oral medications that reduce the itch, because usually it's the scratching that then results in the rash. So you march from dry skin, then you get an itch, then you get a rash. So you want to reduce the itching. So you may use oral tablets that reduce that. And once you get inflammation, so that is usually where we use topical or creams that reduce inflammation, that may have topical steroids. Some may not have steroids, but they're also addressing inflammation. In cases where there's severe eczema, we can use or borrow agents that suppress the immune system. So we can borrow immunosuppressive tablets that we use, but that is when we have really, really severe form of eczema. Another way that we use to treat eczema is to borrow from light. So we can do something called phototherapy, where we expose our patients to ultraviolet light B, and we know that basically addresses the inflammation. So you treat the inflammation using topical or oral anti-inflammatory agents. You treat the itch using oral agents. But the most important thing is you need to address the barrier by moisturizing.
Okay. While we are there, Doc, let's introduce psoriasis and tell us what it is and how it differs from eczema.
So they can look the same. They can, to a non-trained eye, they can look the same. They are both conditions that are chronic. They can affect us lifelong. They are both conditions that would lead to dryness and scaling. However, eczema has a lighter or a smaller scale. People with psoriasis have thick scales. I'm not sure if you've seen someone with psoriasis. They have very, very thick scales. We always call it like a silvery scale or like an asbestos scale that is stuck on the skin. It will be on their knees, on their elbows, and they have a lot of dandruff if it affects the scalp. But psoriasis doesn't only affect the skin. They may have joint problems, they have distracted nails. So it tends to be more, systemic than atopic eczema. And also, so the sites are also different. So these ones, elbow outside, outer knees. Eczema is going to be on the inner side of the arms. It's going to be behind the knees, around the eyes, on the face. So the sites that they affect are different, and also the nature of the actual scale is different, and the immune system works oppositely in terms of, when we talk about the immune system of these conditions. And one tends to be a little bit more aggressive when it comes to internal organs. Individuals with psoriasis can get liver problems, hypertension, heart problems, a lot of psychological issues, because it is a bit of a more aggressive condition. But they can look the same, and when they heal, they look the same.
We mentioned that we are in our new home in Durban, and usually in Joburg we would speak strictly of the streets, but because we are here, we also have the streets and the beach. Now, let's see you after an ad break, and let's talk about what happens, the people at the streets.
And the beach.
And the beach.
Hayi, igama lami ngumlungisi wangobese. Ngithi angibuze la ukuthi dokotela yini igama yini ekhoza lento le iskin sibe namaqhuqhuva ekuthiwa i-eczema.
Avuxeni. Mina Khensani Mabasa kusuka eLimpopo eGiyani. So ni le ku rhendzelekeni kwala Durban na a beachini. So na xivutiso, ene xivutiso lexi ni nga na xona i ku vutisa ku loko munhu a ri na ti-skin tag la mirini wa yena ti susiwa njhani or ti affecta yini emirini wa yena, and loko ti nga remove kumbe ti nga susiwi ti nga affecta yini in future. Inkomu.
Ya, ligama lami ngingibongane ngwakamathunjwa from Eswatini. I-eczema kuyiconza kwami sifo lesingalapheki. Sivama ke kubonakala ngokuthi uvele i-rash, more especially la nsanyeni, etandleni, la inside elbows nakuma knees. Ivama kuhlasela ke bantwana kakhulu, ayilapheki, but uyayizama ngokuthi uyithinsebalisa ngokuthi nje ugcobise i-cream yakhona ungayinwayi.
My name is Mufudzi, and when I was born, I had a skin condition called eczema, and my face was a mess. So all my baby pictures are not that cute because I had really bad skin. And then my mom says the story that she simply prayed for me, and the eczema went. Like to this day, I don't have any marks anywhere. So I guess maybe a question to the doctors is, have you guys seen much resolving of skin issues with prayer? That would be quite an interesting question for you guys. But legit, how do people have eczema that resolves spontaneously on its own? Yeah, That's my question. Thank you so much. Cheers.
Ubazwile abantu bala ekakasini doc babuzile.
Yes.
Now, let's entertain the one about eczema either spontaneously disappearing or maybe through divine intervention.
Yes, eczema can clear on its own. We look at different grading when we look at eczema. It can be mild, it can be moderate, it can be severe, and mild eczema sometimes responds without any clinical intervention. But also, if someone was experiencing eczema as a child, remember I said sometimes you may have eczema as a child, and as you grow, you no longer have it. So it improves with age. There's a lot, we know that individuals that suffer from eczema have poor quality of life, they have poor sleep, they've had, there's links between anxiety and depression. So there is some sort of, psychological intervention. And obviously, if we're looking at alternative therapy, there's many therapies that have been used in India and in other parts of the world where you use prayer, yoga to improve the clinical signs of eczema and also just, the symptoms of eczema.
Just as a side thing, I have an aunt that was diagnosed with breast cancer in her 20s. She was a woman of prayer.
Yes.
But I think the combination of cleanliness in her life made her only pass away at the age of 89. So she must have gone through 60 years of breast cancer. And one of the things that complicated her life was the radiotherapy that went through her breast and her lungs.
Yes.
And she ended up with respiratory problems.
Yeah.
So now and then she would go into respiratory issues, and then we would take her in, and then she's relieved, she can breathe again.
Yes.
Yeah. So it's not necessarily that far-fetched.
No, we can't dismiss those things because we know they're there and they have helped.
Let's wrap your head around the concept of eczema of the ear.
So I was trying to make sense of that question, and trying to think what could be the reason for that. So yes, eczema can affect all areas of the skin, but it's very, very rare for us to have thick scaling of the ear to lead to hearing impairment. Psoriasis, on the other hand, does affect the ear and the ear canal, and sometimes the scales can be a lot and they can be aggressive and maybe cause a little bit of hearing impairment. But there's a group of conditions in the skin that we call primary immunodeficiency syndromes. So in these individuals, it's the immune system that has a problem, and when the immune system has a problem, it may react excessively to stimuli like allergens and stuff, and those individuals can get eczema or eczema-like reactions. So in that case though, those patients don't just have eczema. They may have involvement of the teeth, they may have involvement of the eyes, they may have involvement of all mucosal surfaces, maybe the ear, liver disease, and so many other things. So I'm wondering if maybe is this just pure eczema, or we're dealing with another condition that is affecting, which is systemic and now affecting hearing.
And in the same light, children, it's common to have bacterial infections that could just be pustular, and that causes crusting in the ear canal that to the untrained eye, like you said, may look like scaling that you would see with eczema.
Yeah.
And then Doc, please tell us the one about amakukuva.
Yeah, so eczema can take different forms. Usually the rash is red and it's scaly and it's weepy, but sometimes you can have isolated pimples or papules, and usually these individuals scratch a lot, so these become nodules and they become hard. So you get patients with papular eczema, which is that one, or nodular eczema, which are large, bigger, harder sort of pimples. In children, you also get a type which we call papular urticaria, almost like exaggerated insect bites. So they all come up as pimples. So you don't always get a rash. Sometimes you get, discrete papules or pimple-like.
Speaking of a rash, Doc, now it's your turn to go viral and tell us regarding monkeypox. When do we get a rash, and what are the general symptoms of monkeypox?
So generally you have what we call a flu-like illness before you get the rash. That's what typically should happen. And the rash, it usually starts off with maybe a small pimple that develops into a blister, and then it starts crusting and it heals. And that usually follows several weeks, maybe 1 to 2 weeks, for that whole process to actually finish. Yeah.
We hear that monkeypox is, thankfully, almost self-limiting. It can go away with time.
Yeah. No, it's one of the fortunate things about monkeypox that it's self-limiting. Rarely do you have someone who gets really sick, or they need treatment, or they require hospitalization, or even die from monkeypox. So you just leave the process to follow through with the rash, and then things will settle down. Yeah.
And but in the meantime, one has to avoid close contact, because that's how it's transmitted.
Yes. The minute you start developing symptoms from monkeypox, that's when you are more likely to actually spread it. So in that time, you need to isolate. I think everybody's familiar with the word isolation now, post-COVID. So you need to isolate, avoid contact with people. So until the last pimple is healed and done, you can still spread monkeypox. So that means it's not the typical 7 to 10 days that you would just think of. You have to wait for the last one to heal and finish.
And from your side, Doc, I can't help but ask about the scarring.
Fortunately, I haven't come across monkeypox in my clinical experience. It's a new disease. But the principles of treating scars are the same. You treat early, and it will depend on the type of scars that it leaves. It's not one, though, that actually leaves deeper scars. Chickenpox tends to cause a lot of atrophy to the skin versus monkeypox. So I do think with early treatment, early interventions, we can address the post-inflammatory hyperpigmentation that you see.
Now, Doc, let's talk about the interesting part of the episode. We talk myths. And somewhere along the line, it said that you have to have, for certain types of rashes, and I suppose in certain cases, our people wouldn't have been able to differentiate whether it's eczema or what.
Yeah.
Are there rashes for which you have to have rituals? Like your uncle puts ash all over the child's body and put a 5-cent coin just to top it up. Does that work?
So, no, it's a myth that you can do certain rituals to treat or cure eczema. And we always discourage the use of, irritants or anything that you apply to the skin that could potentially cause inflammation. And these would be things like maybe herbs or natural products, fragrance products, or products that may have color, because anything that can enter into the skin can potentially worsen eczema and spread it.
So one of the aims of the show is always to leave our viewers with some sort of empowerment, knowing what tips they should take home. What are the do's and don'ts when handling eczema at home? What tips do they need to do in order to not aggravate it and just to manage it? I mean, we mentioned moisturizing as one.
Yeah. So you want to avoid anything that irritates the skin. You want to avoid using hot water. You want to avoid long showers or long baths. So you keep your baths short and lukewarm water. And then you want to avoid products, as I said, with color, perfumes. You want to move for hypoallergic products, and you want to use moisturizing moisturizers. And sometimes, we have nice moisturizers that are smart enough to be able to bring water into the skin, seal it and keep it in. And you can also use, people love their oils, and I don't have a problem with oils. I always say put a base moisturizer that's going to concentrate on the natural oil of the skin, and then if you want to occlude with your oil, it's fine. But you don't want to just be using oils on their own, because they're not going to hydrate, they're not going to moisturize the skin. And when you're moisturizing, you want to do it often, 3-4 times a day, especially in the winter months. Avoid any harsh ingredients. And if you do have eczema, the trick is to treat it quickly, before it scars, before you get infection in the skin.
So the aim is really to seal the grout, seal the crack, and lay the foundation right.
And hydrate and moisturize.
That is wonderful. And so where can people find you? I mean, you've given us such insightful thoughts, and eczema is surely something very common. So where does someone go when they need help?
I'm in Durban. I'm at the eThekwini Heart Hospital. But people can also find me on social media, on Instagram, Dr Nokubonga Khoza Derm, and on Facebook, and through my website, durbanskindoctor.co.za.
And don't forget, Dr Nokubonga Khoza is also on the list on the website of all the doctors. Go to www.askyourdoctors.co.za and go to Find Your Doctor tab. She will be there, and you can download the details should you require her help.
And to all the brands out there, if your brand aligns with our brand and you would like to have your brand on our platforms, please do use the email address on the screen, or you can drop us a DM on our socials, that is Facebook or Instagram. And once again, Doc, thank you for hosting us for the past few weeks. We think this is a good home. We probably do want to stay here.
No load shedding, and it's warm.
Yeah,
Yes.
we wouldn't mind. Yeah.
Thank you very much. Thank you for having me, and
Thank you
for
very
the
much.
questions.
Yes, it's been very informative, and I'm sure all our audience have taken something away from all the weeks that we've had with you. Thank you very much.
Thank you. Thanks.
So that's all from us today. Till next time, this is Ask Your Doctors. So keep asking your doctors, and we hope to see you soon.